ever feel like just staying on top of healthcare here in Kenya is like a full-time job.
Right.
We'll get ready because big changes are coming. We're talking a whole new health insurance system, and we've been going through the social health insurance general regulations 2024, so you don't have to.
Yeah, a lot to unpack here.
Yeah.
It's a whole different ballgame from that old NHIF we used to have. This new system, though, they're aiming for bigger coverage, and they want to reach every single Kenyan.
Okay, so let's break this down a bit for our listener. Like, what's the need to know, like, right now?
Biggest thing, they're bringing in not one, not two, but 3 different funds. The primary healthcare fund, then there's the social health insurance fund, and topping it off, the emergency, chronic, and critical illness fund.
Okay, so each one kind of like what? Build on the last one?
Exactly. Think of them like levels, different levels of coverage.
Okay, makes sense.
So everyone in Kenya, automatically you're in that primary healthcare fund. That's your basic checkups, right? Essential services, that kind of thing. It's like your safety net, making sure everyone at least gets basic healthcare.
Okay, that makes sense. But what about that next step up, that social health insurance fund? That one's not automatic, is it?
Nope. This is where it gets important for everyone listening. If you want the good stuff from the social health insurance fund, you gotta register. We're talking mandatory, every single person living in Kenya.
Every single person. So like newborns, your grandparents?
Even if you're, let's say, otherwise engaged.
Okay.
The rules are clear. Got to be registered within 90 days of October 10th, 2024. No excuses.
Wow, okay, so that's a hard deadline. But before we get into all that registration stuff, tell us what we get. What's the social health insurance fund actually cover?
Now, this is the good stuff. It's not just basic care. We're talking specialized scans, surgeries, the whole works. Mental health care, maternity care.
Wow.
They've even got organ transplants in there.
Organ transplants. Yeah. That is impressive. It sounds really comprehensive. Makes you wonder, what's left for that emergency fund then? If this one's covering such big stuff, why even have another level?
Good point. That emergency fund, that's for when things get really serious, really expensive. Think like major accidents, heart attacks, situations where you need care immediately. And it could cost, well, a lot.
So it's like a safety net on top of the safety net.
Yeah, exactly. It's there so that even if you use up everything the social health insurance fund allows, you're still covered for those critical situations. And here's the kicker. You're covered for emergencies even if you haven't gotten around to registering for that social health insurance fund yet.
Wait, really? So even if I'm like dragging my feet on the registration, I'm still good for like life or death situations?
You got it. The rules are clear on that. Those dire situations, you're covered. It's made to protect everyone, registered or not, at least for those.
Okay. That's a relief, honestly. But going back to registration, we've got people with disabilities, elderly folks. Are they expected to handle all this themselves?
No way. They've actually, the regulations specifically mention they need to make it easier for those folks, people with disabilities, the elderly, even, well, anyone who, let's just say, can't easily register on their own.
So they really did think of everything, huh? Okay, so we've got who needs to register, what about the cost? What's it going to, like, set the average Kenyan back each month?
Well, it depends. If you've got a regular salary, it's straightforward. 2.75% of your gross pay goes to that social health insurance fund.
Okay. So say someone's making like 50,000 shillings a month.
Let's see. Just over 1,300 shillings. Not bad for that level of coverage. Oh, and it's capped, by the way. So it doesn't matter how high your salary goes, never less than 300 shillings a month.
Built-in minimum.
Oh.
Interesting. But what about everyone else? Those not on a fixed salary? How do they contribute?
That's where it gets a bit trickier. They've got what they call a means testing instrument to figure out contributions for those not on a regular income.
Means testing instrument.
Yeah.
Bit of a mouthful, isn't it?
Basically, they'll look at your situation, your income, any property, even if you've got access to basic services, it all factors in, trying to make it fair for everyone.
Okay, so they're aiming for a system where everyone chips in based on what they can manage. But what if someone genuinely can't afford even that minimum contribution?
Another good point. And they've addressed that too. The government's stepping in to cover those who really can't afford it. You know, those below the poverty line, folks under lawful custody, those kinds of situations, making sure everyone has at least some safety net.
Sounds like they've really thought this through, huh?
Yeah.
Trying to make it both comprehensive and, fair.
Exactly. And we're just scratching the surface here. Wait till we get into the benefits package itself.
So we're back, and we're really getting into it now with Kenya's new health insurance. Before, we were just about to dive into those benefits packages, the good stuff. What do you actually get for your contributions?
The really exciting part, right?
Uh,
And it is exciting. This isn't just your typical basic care. We're talking comprehensive coverage here, designed to cover a whole range of needs.
Okay, so walk us through it. We know there are those different levels. What's different about the benefits you get with each one?
Okay, so imagine it like this. You go up the levels and the services get more specialized. Makes sense, right?
Makes sense.
So that primary healthcare fund, that's your automatic one. That's like your first stop. Think like consultations at your local clinic, basic maternity care, essential medicines. It's all about keeping you healthy and catching things early.
So preventative stuff, your
Yeah.
everyday needs.
Mhm.
Okay. What about that next level up, the social health insurance fund?
Now we're talking. That's your ticket to those more specialized treatments, procedures, that kind of thing. Surgeries, both big and small, specialized scans, MRIs, CTs, even treatment for those long-term conditions like diabetes or heart disease.
Okay.
And remember those organ transplants we mentioned?
Yeah.
That's covered under this level.
Wow. That's a big step up from that basic package.
Right.
What about mental health? Is that covered under the social health insurance fund too?
100%. And we're not just talking about a quick chat either. Therapy sessions, access to psychiatric care, even medication. It's all in there.
That's good to hear. Okay, so even with that social health insurance fund, sometimes things happen, right? Bills get out of hand. So in those really serious situations, that's where the emergency fund comes in.
Exactly. It's there to, well, hopefully you'll never need it, but if you do, it's there to prevent complete financial disaster if something really serious happens. Think like a bad car accident, really complicated surgery, or if you need treatment for a life-threatening illness.
Right, those situations that
Yeah.
could just wipe you out financially. Okay, so we've got these levels, these funds, it all sounds good, but how does it actually work when you need it? Say, I need to make a claim. What's the process like?
Well, this is where things get really interesting and where Kenya's gone high-tech with it. They've set up the centralized digital platform, and it manages everything.
Everything.
Pretty much.
So no more paperwork.
You got it. Think of it like a one-stop shop for all your health insurance needs. You can register for the Social Health Insurance Fund right there on the platform. You make your contributions through it, even track how you're using your benefits all online.
Okay, that's handy. But what about when you need to use it to actually make a claim? Can you do that online too?
Absolutely. So say you need a procedure and it's covered by your benefits package. You'd go to a healthcare provider, obviously, one that's part of the system, and they log everything on the platform. Your diagnosis, the treatment, the law, it's all digital.
Streamlined. I like it. Okay, but what if, for some reason, my claim is denied? What happens then?
That's the beauty of the digital system. It's all transparent. You'll be able to see exactly why the claim was denied. Plus, there's a clear process for appeals, and you can do it all through the platform. Just upload any documents or information, and you're good to go.
So they've really tried to make it user-friendly.
Exactly. It's not about keeping people in the dark. It's about making the whole process smoother and easier for everyone. And they've gone a step further, too, with what they're calling health technology assessments.
Health technology assessments. That sounds pretty intense. What are those?
Basically, it's about making sure that the treatments and procedures covered by the benefits packages, they've got to actually work and be worth it, right?
Okay, yeah.
So they're using these assessments to look at the latest medical research, the data, all of that, to evaluate how effective different treatments are, how safe they are, and are they actually worth the cost?
So they're not just throwing treatments into the benefits package willy-nilly, hoping for the best.
Exactly. They're trying to be smart about it. They're looking at things like how common a certain disease is here in Kenya, whether a treatment is actually accessible for everyone, and can it actually be implemented across the country?
So it's about finding that balance, making sure the care is comprehensive, but also that it's sustainable.
Exactly. And that's where this dedicated group comes in, the Benefits Package and Tariffs Advisory Panel. They're the ones overseeing all of this.
The Benefits Package and Tariffs Advisory Panel. Tell me more about this panel. Who are these people making these big decisions about healthcare?
It's not just a bunch of, bureaucrats in an office somewhere. This panel, it's made up of experts from all over, university researchers, financial people from the National Treasury, healthcare providers from across the country, even folks from civil society organizations.
So a real mix of voices then.
Absolutely. It's about bringing different perspectives to the table, and they're not just there to say yes to everything. Their job is to really scrutinize and update the benefits packages every 2 years, make sure they're still relevant, that they reflect the actual healthcare needs of Kenyans.
So constantly evaluating, making changes based on new research, technology, and I guess just how things are actually playing out for people.
Exactly. And that's not all. Remember those tariffs we were talking about before? The rates that healthcare providers get for each service?
Right.
Well, this panel, they're key to deciding those too.
Okay, so let's talk about that. How do they actually figure out how much each treatment or service should cost under this new system? Because that sounds incredibly complex.
It is complex, and it's a crucial part of making this whole thing work. But we'll get into all the details of that right after this quick break. Don't go anywhere.
Back again. Before the break, we were getting into those tariffs, basically what everything's going to cost under this new Kenyan health insurance plan.
Yeah, the price tags for all those treatments and services.
Right. And we were saying how important it is to get that part right.
Absolutely. Got to make sure healthcare providers are getting paid fairly, but also that the whole system can actually, sustain itself.
Exactly. So how do they even begin to figure out these tariffs? It sounds incredibly complicated.
Oh, it definitely is. And that's where our expert panel comes in again. The benefits package and tariffs advisory panel, remember them?
Right, the ones with all those different experts.
Yep. They're the ones crunching the numbers, making the tough calls.
So what all goes into those calculations? Give us the inside scoop.
Well, they take a really data-driven approach, which is good.
Okay.
So first, they look at what it actually costs to provide a specific service. We're talking like staff time, the medications they'd use, equipment costs, the whole shebang.
Makes sense. Get that baseline.
Right. But then they factor in other stuff too, like how much demand there is for that service. Is it something everyone needs all the time, like a checkup? Or is it something more specialized that only a few people need?
So it's like the individual cost of the thing, but also how often they think they'll have to pay it.
Exactly.
Okay, that makes sense. But we all know healthcare costs can be, well, unpredictable, to say the least. How do they make sure those cost predictions are accurate?
That's where the data crunching comes in. They're looking at tons of information from stuff healthcare providers give them directly to data from, like the World Health Organization, even down to how long certain procedures actually take. It's all about getting a complete picture.
Wow, so they really are doing their homework. Okay, so say they've got all these numbers, they've analyzed everything. What then? Do they just set the tariff and that's it?
Not quite. Remember how we talked about how important stakeholder engagement is for this whole system to work?
Right, getting everyone on board.
This is where it comes in again. Once they have an idea for a tariff, they take it to the stakeholders, healthcare providers, insurance experts, even patient groups, and they get their feedback.
Oh, interesting. So it's not just a one-way street. They're actually listening to what people think.
Absolutely. Got to make sure everyone feels like it's fair and that it'll actually work in the real world.
Right. You don't want people rebelling against the system before it even gets started. Okay, so they gather all the feedback. Then what? Who makes the final decision on those tariffs?
Well, the panel gives its recommendations, but ultimately the final say comes down to the cabinet secretary.
Okay.
So they review everything, and they can either give it the green light or send it back to the panel for another look if something doesn't seem quite right.
Another level of checks and balances. I like it.
Exactly. It's all about making sure it's as fair and as balanced as possible.
It sounds like they've really put a lot of thought into this new system.
They really have. It's ambitious, but you can tell they're trying to learn from what's worked before, what hasn't, and most importantly, they're trying to make a system that actually works for Kenyans.
Well said. So for our listener who's probably taking notes like crazy right now, what's the main thing to remember about all of this?
I'd say this new system has incredible potential, could really be a game changer for healthcare in Kenya. But like anything new, there's going to be an adjustment period. So stay informed, don't be afraid to ask questions, and familiarize yourself with how it all works.
Knowledge is power, right? And hopefully we've helped with that a little bit today. That wraps up our deep dive into Kenya's new social health insurance system. We'll keep you updated as things progress, but for now, stay healthy out there.